I'm Sherry Boschert reporting for IMNG Medical Media at Stanford University's annual Pediatric Update. It's important for physicians to identify adolescents who are experiencing abusive dating or reproductive coercion. These common and underappreciated problems can have lifelong medical consequences. Dr. Harise Stein explains.
The reason that it's important is because it impacts almost every aspect of their life. It can affect their physical health problems. People who have asthma or migraine headaches can be made worse by the stress of being in this abusive relationship. There can be reproductive coercion and contraceptive sabotage so that there's an increased risk of pregnancy. And abusive partners refuse to practice safe sex often, so then we're talking about STDs and HIV that can have lifelong repercussions for these girls.
So it sounds like there's all kinds of abuse. There's physical, emotional, social. Can you talk a little bit specifically about reproductive coercion? What is that?
Reproductive coercion is basically having a partner control a girl or a woman's plans for her reproductive life. And this can be encouraging or subtly sabotaging birth control so that the person becomes pregnant, or not having pregnancy if the girl wants to be pregnant. So basically it's having one partner be in control of what is going on reproductively.
So what should physicians be thinking about when they see adolescent patients that maybe they're not thinking or doing right now?
Well, I think recognizing that dating abuse is very pervasive and that it impacts a lot of areas of a person's life. And so they may not be thinking about their adolescent patient who has these migraine headaches as being worsening headaches due to a relationship problem. There can be school issues, personality issues. So if there's symptoms that sort of don't seem to make any sense and you can't figure out what's going on, thinking about whether there might be something going on in a relationship, possibly in the family, but also in a dating relationship. And obviously, if they come in and they want emergency birth control, if they have an unplanned pregnancy, if they have a new STD diagnosis, these are things that are more obvious to think about. Being very aware for things that you may not suspect. Injuries. The most common injury is defensive injuries of the forearms. And in teenagers, when we talk about physical abuse, most of the time it's pushing, shoving, yanking, pulling type of thing, and there might be some bruises or some scratching. But the most common is defensive injuries of the forearm. So you might see some bruising or scratching along here when people are trying to protect themselves. And you may not think about that very much. You might think it's a sports thing or whatever, but if you see this just in this place, that's something to consider. I would highly recommend something called the Heart Primer. It's written by Elizabeth Miller, who's an adolescent physician. And it has very excellent and extensive information for you, exactly on what to say. There's multiple scripts, there's multiple ways of talking to an adolescent patient. There's a lot of information about confidentiality and laws relating to what is required for you to report or not.
Reporting for IMNG Medical Media, I'm Sherry Boschert.